can lead to skin inflammation, redness, and even it can lead to breakouts. The biggest misconception that people have about sunscreens is that
So today we have a phenomenal guest joining us, Dr. Latika Arya. She is a renowned dermatologist having 25 years of experience. She specializes in skin issues, hair problems and anti-aging treatments. She not only believes in external skincare but also internal well-being. So Dr. Latika Arya, hi, how are you feeling today?
I'm feeling great. It's a pleasure to be here and thanks for inviting me.
Definitely, it's a great pleasure to meet you. All right, so these days people are going crazy about skincare.
That's true. It's like, it's the latest buzz in everybody's life to, have a skincare routine, and people are just curious to know what is the right skincare product for them, and so many details they want to know.
Definitely. So today we are going to start with very beginning, that is cleansing. So there's a lot of debate that what kind of cleansers we should use, like foaming, gel based face washes or cream based. What's your take on this?
Great question. So, cleansing is the cornerstone of any skincare routine, and cleansing serves very important function, that is removing the sweat, the oil, the makeup, sunscreens and pollutants from the skin. So it's very important to cleanse the skin twice a day, and that is usually suitable for most people. Unless somebody has a very dry skin, then they can just do cleansing at night. So cleansing basically, the type of cleanser depends on the skin type. So for example, if somebody has an oily or acne prone skin, so for them foaming face washes work well, especially those containing salicylic acid.
Okay.
And if somebody has a dry skin, then for them creamy face washes are preferred because they hydrate while cleansing.
Okay.
And then people who have sensitive skin, so for them we use hypoallergenic, fragrance free, gel, very mild face washes which may contain soothing agents like aloe vera, ceramides, etc.
Right. Interesting. And Dr. Arya, what about these trending double cleansing methods? Like, are they really necessary?
Right, so double cleansing is trending nowadays, I agree, but double cleansing is not for everybody. It is required for people who use heavy makeup or use waterproof sunscreens. So then in this case, the first cleansing is done with the oil based cleanser, provided they are not acne prone. If they are acne prone, then they need to use micellar water. So that will remove the oily makeup and the heavy sunscreens. And then the second step is with the water based cleanser. So that will remove the rest of the impurities. But if somebody's skin is already dry or they are not using makeup, so for them single step cleansing is enough.
All right. Okay, now coming to the toning part. So toner seems to divide the skincare community. Some swear by it and some calls it unnecessary. What's your take on it?
So toners come from an era when cleansers were a little harsh for the skin.
Yeah.
So toners were required to rebalance the pH of the skin. But nowadays cleansers are so gentle and well balanced. So one really doesn't need a toner. So, but still if somebody needs it for some additional benefit like some moisture or some skin soothing effects, so they can use toners which contain niacinamide or hyaluronic acid. But it is not a necessary step.
All right. So serums are all the rage, but it can be very overwhelming for the beginners. So how does we choose the right serum for ourselves, and what kind of active ingredients it must be included?
Right. So absolutely serums are all the rage, and actually these are the skincare superheroes which are loaded with like concentrated ingredients.
Yeah.
So they penetrate directly into the skin, producing the benefits. So the main serums which one must have in their skincare routine are vitamin C. So that is a brightening serum and it has antioxidant effects.
So every skin type people can use it?
Not for everybody, but if generally like people are having exposure to pollution and they have a normal skin type, they are not having acne breakouts, so they can use vitamin C.
Okay.
And then we have hyaluronic acid. So hyaluronic acid, as we all know, it boosts the hydration and it plumps the skin. Then coming to niacinamide. So niacinamide reduces the skin redness, inflammation, and it boosts the skin barrier. It's also helpful in lightening the pigmentation and reducing the oiliness of the skin.
Okay.
And then retinol, it's a super powerful ingredient.
Yes.
So it basically boosts your skin's collagen and helps in reducing the fine lines and the open pores and improves the skin texture. But it's very important to use these serums in the right manner and the right timing, and not to start all of them suddenly. So introduce them into your skincare routine one by one.
All right. For this also they can take recommendation from dermatologist.
Absolutely. It's based on their skin type, their concerns, and what will be beneficial for them.
Yes. All right. So now coming to exfoliation. So exfoliation is another area rife with controversy. So there's a trend that people use multiple exfoliate products in single routines. So can over exfoliation can really harm the skin?
Yes, so see, exfoliation is a very important part of skin turnover, but over exfoliating can be counterproductive. So it can lead to skin inflammation, redness, and even it can lead to breakouts. And moreover, I have seen along with the chemical exfoliating agents, people are even using physical scrubs, leading to massive skin irritation, and instead of getting a smoother skin, they start getting a rough and an inflamed and a drier skin.
Right.
So there has to be a careful selection of exfoliating products in your routine. So one needs to space it out and see as per the skin's requirement, because when there is over exfoliation, the skin barrier gets broken down, and the skin gets a signal that it's dehydrated, so it even produces more oil. So that leads to acne. So one needs to be little cautious.
All right. So what's the balance? Like how often should we exfoliate?
So usually like once a week or twice a week is good for most people, and one needs to look for the signs of any redness, stretchiness, dryness, tightness. So if this is happening, then you need to scale it down, and it also depends on the season. For example, in summer or humid season you can use it more frequently, but in winters you have to reduce the frequency of using exfoliants in your products.
Okay. So now moving on to moisturizer. So people with the oily skin and acne prone skin believes that they don't need moisturizer. What's your take on this?
That's a common misconception. Even acne prone and oily skin needs a moisturizer. In fact, if they don't apply a moisturizer, the skin gets a signal that it's dehydrated, and then it even produces more oil. So the key is to use moisturizers which are lightweight and non-comedogenic, containing ingredients like hyaluronic acid, ceramides, glycerine, which will just hydrate the skin without clogging the pores.
Okay. And some people believe that using a thick layer of petroleum jelly at night can actually work. What's your take on this?
Yes, this has been a trend on Instagram recently called slugging.
Yeah.
So basically, it is not for all the skin types. So if somebody's skin is very dry or the barrier is compromised, then it will help to seal the moisture and rehydrate the skin. And once the skin is rehydrated, it looks more glowing. But if somebody has oily skin or acne prone skin, it is a strict no-no for them, because it can increase their breakouts. So it all depends on your skin type.
All right. So there's a fun fact that a well moisturized skin appears up to 20% younger than the dehydrated skin. A good moisturizer can really be a game changer. So now let's talk the sunscreen, a non-negotiable hero. So Dr. Arya, we believe that it is a non-negotiable hero, but perhaps a misunderstood step in every skincare routine. So just tell us that what is the biggest misconception in sunscreen which people believe?
The biggest misconception that people have about sunscreens is that they should only use it when they are going outdoors or when they are going to a beach. But UVA rays are present every day, even on cloudy days, even on rainy days, and they can even penetrate windows. So one needs to use the sunscreen every day.
All right.
And the second misconception people have is that the higher the SPF, the better it is.
Yeah.
But sunscreens which have SPF of 30 plus, so they are protecting us from 97% of the UV light.
Okay.
And increasing the SPF gives only a marginal benefit.
Okay.
Yeah.
Also, is it true that sunscreen can really help with the anti-aging?
Yes, so ultraviolet light is the major cause of skin aging. So if one is using sunscreen consistently every day, they can really prevent aging to a great extent. So I recommend my patients to use to repeat their sunscreen every 2 to 3 hours, especially if they're outdoors and they have been sweating. And plus I tell them to use a broad spectrum sunscreen which has both UVA and UVB protection.
So I also want to ask one question here, that what is the right order of using the skincare products?
Right. So as you know, cleansing is always the first step, and then some people need a double cleansing, so that is going to be part of the cleansing procedure only. Then next step is optional, that is the toning. So we discussed it in our earlier question. And then it's very important for the moisturization step, because moisturization will form the base where it will hydrate the skin, it will protect the skin, and some people may not need any other step, that may be enough, especially in the night, but in the morning after the moisturizer they have to use the sunscreen. But if somebody is having some concerns or they are into preventive skincare, so then they need to add certain actives to their skin routine. We have discussed all the actives like vitamin C, niacinamide, hyaluronic acid, peptides, retinols. So usually the actives like vitamin C, niacinamide, hyaluronic acid, they can be used in the morning, and generally for the night we provide the retinols or other exfoliating agents like AHAs, BHAs. So these are applied in the order of their consistency. So the thinnest product is applied the first. For example, serums are put on first, then followed by the creams, and then finally the moisturizer can be applied.
Okay, great bundle of information. Alright, so what are the common myths about anti-aging?
So the common myths which I hear from people about anti-aging is that there are certain products, if we recommend them, they think that it will cause them some side effects or it will damage the skin. And secondly, they think that anti-aging can happen sometimes just with the creams alone. But sometimes the sagging is already so advanced and the skin is very loose, so it will not really respond just to the creams, it will require some treatments also. And the other thing is that people think that if they have done some treatment that it's going to last them forever. So anti-aging is a continuous process, because as we are aging is a natural process, so we need to follow with the maintenance, etc.
Definitely. So with this I would like to ask that what are the right ingredients and products we can use to prevent anti-aging or cure aging?
Right. So the most effective anti-aging skincare product, as we all know, is retinol. Okay. So retinol helps to boost the collagen production, and it helps with the fine lines, the wrinkles, the open pores, and it improves the skin texture. And regarding the retinol, people think that it will thin their skin, but that's not true. It actually thickens the dermis and gives a better skin barrier. Then the other popular ingredient is hyaluronic acid. So hyaluronic acid binds water, improves the skin hydration, and it plumps the skin. So along with hyaluronic acid, one needs to take care that it should be followed up with the moisturizer also to seal in the moisture. Then the other important ingredient is vitamin C. Especially for young people, they should start with vitamin C. So vitamin C has an antioxidant effect, it improves the collagen synthesis, it also has a brightening effect on the skin. However, sometimes, like we were discussing, that people who have acne, they may not tolerate vitamin C. So as per the skin type, it can be discussed with their doctor and whether it will be helpful for them. And then there are other ingredients also like peptides. So peptides, they give a signal to the collagen producing cells to make better collagen. Of course, they are not as effective as retinoids, but it can be added to a skincare routine, and especially it's very good for people who have sensitive skin who cannot tolerate retinoids. So peptides are a good addition.
Okay. Alright, so with this definitely we would like to know that what are the professional treatments?
So professional treatments, we can divide them into two groups. So one is the preventive treatments and one is the corrective treatments. So the prevention is to be started by people of younger age, so like early 30s and early 40s. So before the damage has been done. So for this, the treatments which help are like chemical peels. So chemical peels which are deeper exfoliating treatments, professional treatments. So they help to stimulate your collagen, improve the melanin and improve the pigmentation. Then we have a very popular treatment called microneedling. So in microneedling we use either a derma pen or a derma roller, or there are other instruments as well which give micro injury to the skin that stimulates the collagen.
Okay.
And in addition to the microneedling, we can add certain serums. For example, we can add, nowadays we have exosomes, we have PDRN. So they are very powerful stimulators of collagen. And we have also been using the platelet rich plasma. So PRP it is called. It is derived from the patient's own blood, which contains the growth factors. So they stimulate collagen. Besides then we have the energy based devices, so whether ultrasound based or radio frequency based, so they also stimulate the collagen and tighten the skin, and they give a lift also.
Okay.
Yeah. So, and then the corrective treatments are when the sagging has already occurred and there are visible aging signs on the skin. So for these cases, we have Botox, we have fillers. So Botox works on the dynamic lines, for example, the crow's feet, the forehead lines, the frown lines. And fillers are given where there is a volume loss. So they help to recontour and lift the face. And then sometimes the sagging is too much, we need to also do something called thread lifting. So thread lifting is a non-surgical way to lift the face with the help of absorbable sutures. So these are some of the treatments.
Okay, Dr. Arya, so I definitely request you to please give us some tips and insight for the people who are just starting their anti-aging journey.
Right, so I always say start early, but again it's never too late.
Yeah.
So if you are in your 20s and 30s, so start with preventive skincare. Start using a sunscreen effectively, and you can introduce a vitamin C serum, plus you can have a good moisturizer which suits your skin type. Then if you are already 40 plus and you are starting your skincare journey, anti-aging journey, then you can start with corrective skincare products and like retinoids, peptides, hyaluronic acid, and plus you can introduce certain treatments which will help to rebuild the collagen as per the advice of your dermatologist. Then the second important thing one has to keep in mind is that your skin treatment needs to be customized to you, because your skin type is unique to you, whether it's dry, oily, sensitive, combination. So it's better to see a professional like a dermatologist who can guide you what are the correct skincare products for you, so that you know, you in the long run you will save time, you will save money, and you will get a much better result. Then moving forward, consistency is the key. So if people start using the products and they leave midway and they get you know, demotivated soon, so they will not see very good results. So I always say that you know, keep using them consistently. So retinols, they start showing the effect after 3 to 6 months, because they are working on your fibroblasts which are making the collagen, and gradually you will see the improvement in the skin texture, the fine lines, the wrinkles. And plus it's very important not to fall for the trends. So every now and then we see new trends. For example, like people are very fond of using gua shas and jade rollers. So they do make you feel good to some extent, but you know, they are not as effective as the science-backed anti-aging treatments. So always go for the evidence-backed treatments. And then be skeptical of the magical cures. So there are some treatments, you know, or some creams which promise like an amazing anti-aging very quickly, but be very mindful of those, because aging is a natural process and anti-aging takes time. It's a slow and consistent you know, routine that you will follow, then you will start seeing the
gradually
result.
it happens.
Yeah.
Okay.
And then the most important is, it's not just the external skincare, it's also your mental health, your physical health, and your confidence that matters a lot. So how you feel, how's your mindset, and how's your confidence, how good is your lifestyle, how well you take care of your physical body. So these are all going to reflect on your skin, and they will help you age gracefully. And finally, like you know, so one should accept their beauty, because beauty is a unique trait and everyone is beautiful, and you just need to celebrate your uniqueness.
Definitely wise words. Now coming to the skincare trends which runs on social media. People believe that you don't need to use any cream or so, you can make the DIY mask at home and apply them. So what's your take on that? Like, should we use them, or how much truth behind this?
So see, absolutely one can do the DIY treatments, but it's important to know which ingredients are going to suit your skin. So certain ingredients like honey, aloe vera, they are gentle for the skin and they can be used, and they will give some limited benefit. But if somebody is using harsh products like lime juice or baking soda, they can actually damage the skin. And as we know, aging is a natural process, it is meant to happen. So these products cannot prevent aging, they cannot correct aging, but they can keep the skin glowing, or maybe to some extent. So it's always better to go in for the certified and the scientific skincare treatments which are proven to have the anti-aging benefits.
Right. So, Dr. Arya, we know that you believe not only in external skincare but also internal well being. So, how do you combine these two?
Right. So, as we know, skin is an organ, the largest organ of the body, and it is not separate from our internal body. So, as our internal body is, so is the skin. So, along with the external skincare advice that I give regarding what products to be used for their skin type and for their concerns, and plus if any treatments are required to correct the issues which the person is facing, I emphasize a lot on lifestyle changes. So, lifestyle includes your diet, the water intake, what time the person is sleeping, how much exercise they are doing, which exercise they are doing, and then how is their mental health if they are facing any stress issues. Because each and every factor of this is affecting the skin, and that leads to, if they are not looked after, that will lead to faster aging. So, I always advocate to focus a lot on your well-being and providing them the tips and the guidance based on their unique situation in life, what circumstances they are in, and then moving forward we start with the skincare routine, so that it gives a holistic approach to skincare and anti-aging.
Okay, that's so wise of you. So, before we sum up this episode, I would definitely request you to please give one piece of advice to our viewers who are watching us.
So, my key message for all your viewers would be that skincare is a journey, and as skin is a part of our health, it's a part of our body. So, along with the skincare routine, we need to also take care of our health, and this way we can have a graceful aging. So, anti-aging is also a journey, so we should not expect overnight results. So, use the right skincare with the professional advice, and stay consistent, take care of your physical and mental health, and I think that's all I would like to give the message.
Definitely, it's a pleasure meeting you. We have got a lot of knowledge from your side. It's wonderful. Thank you so much for joining us.
My pleasure, absolutely. Thank you.
And to all our listeners, if you enjoyed today's episode, make sure to subscribe to Skin Inspired podcast. Share this episode with someone who really needs some skincare inspiration. So stay inspired, stay radiant. Until next time.